going to talk about the skeletal anatomy pertinent to the knee joint injection. So there are two ways to scan the suprapatellar recess of the knee joint capsule. You could scan this in a longitudinal way, or you can scan this in a horizontal way. So start with, if you place the ultrasound, so feel for the patella and place the ultrasound probe on the top of the patella, and then keep moving the probe proximally. Here you will be able to see quite a lot of structures. On the top of the patella, the soft tissue structure will be the suprapatellar fat pad. In front of the femur, another fat pad is located. That's a prefemoral fat pad. And between the two fat pad, you'll be able to see the outpouching of the suprapatellar recess. You could inject this using an in-plane technique. The most important structure that will be in your way would be the quadriceps tendon, and putting the needle through the quadriceps tendon can be very painful. So the tip here would be moving your ultrasound probe's proximal end slightly laterally and looking at the vastus lateralis muscle rather than focusing on the quadriceps tendon, and you'll be able to bring the needle in plane targeting the suprapatellar recess. Another way to inject the knee joint would be from lateral to medial approach in a horizontal view. Once you have found the recess, you will turn the ultrasound probe horizontally looking for the suprapatellar recess and bringing the needle from lateral to medial in plane technique and injecting the local anesthetic steroid mixture or a hyaluronic acid or a platelet rich plasma injection into the knee joint. Thank you. I'm going to talk to you about the intra-articular injection of the knee joint. This is usually performed in the suprapatellar recess of the knee joint. To perform this injection, the steps would be to put a pillow or a rolled towel under the knee. This particular maneuver helps to pull the fluid, the synovial fluid, into this suprapatellar recess. If you make the patient extend the knee, unfortunately this will push the fluid down and you will not be able to see any effusion or fluid in the suprapatellar recess. Hence it's important to give about 30 to 40 degree flexion of the knee in order to see the fluid or the effusion in the joint capsule. The step one would be to feel for the superior pole of the patella, and we will be locating the ultrasound probe on the superior pole of the patella, looking at the quadriceps tendon. And once you locate the quadriceps tendon, there are many other structures you'll be able to see. So here on this particular image, you have a quadriceps tendon, you have superior pole of patella, you have femur. The black area on the top of the femur is a prefemoral fat pad. The black area on the top of the patella is prepatellar fat pad. Between the two fat pad, the black layer you see is a fluid which is a suprapatellar recess. And this recess can be targeted with an in-plane technique, but unfortunately you will have your quadriceps tendon that will be in your view. So the tip here is you will move the proximal end of your probe slightly lateral, allowing you to look at the vastus lateralis muscle instead of looking at the quadriceps tendon. And the needle you will bring in is in-plane technique. So here we have needle coming in plane, moving in, and you will bring the needle in plane, not through the quadriceps tendon, but through the vastus lateralis muscle, targeting the suprapatellar recess. You will inject about 4 to 5 cc's of local anesthetic and steroid mixture or platelet-rich plasma or hyaluronic acid. Another technique to perform the knee joint injection would be a transfer scanning with the needle going in plane from lateral to medial. In this particular image, as you could see, I'm giving the pressure, displacing the fluid from the suprapatellar recess. So the tip here, when you scan the knee in the horizontal view, you have to scan the knee in a very, very gentle pressure of the probe. Here in this image, you see the suprapatellar recess, and you'll be bringing the needle in plane from lateral to medial, targeting the recess. This is the femur. You have a prefemoral fat pad. This is a quadriceps tendon, and injecting the recess with 4 to 5 cc's of local anesthetic and steroid mixture or PRP or hyaluronic acid. And I'll be showing you the needling technique of 50 millimeter or 100 millimeter needle based on the patient's body habitus, but the needle will be coming in plane from lateral to medial, which is much more comfortable than coming through from medial to lateral, given that going through the medial retinaculum can be painful. Thank you.